conversation for today. All the information that you've heard about COVID-19, we know one thing for sure. Our elderly population is more at risk at developing severe complications due to COVID-19, and we must protect them as best as we can. So we're getting the details about what's happening at the Mercy Clinic, which is the only clinic in the country that offers services exclusively for the elderly population. Joining us via Skype this morning, we have Ruth Jaramillo, representing the National Health Insurance Services, and we have Andre O'Brien, who is the director of the Mercy Clinic, which of course is an NHI provider. Good morning.
Good morning.
And welcome.
Good morning, guys. Thank you for having us.
Yes,
Thank you for having us.
So strange, all the online stuff, but we know everybody's trying to stay safe. And let's just jump into it and find out what's happening at the Mercy Clinic. So you guys serve a high-risk population. I'd imagine you'd made some changes from quite a while back, right?
Correct.
Yeah.
So what we did as of mid-March, we have been scaling down on the services that we've been offering, meaning that we have the physiotherapy, the nutritionist, the internist, the phlebotomist service. All of those services has been suspended for the time being, and basically stressing to patients to stay at home. And we've been issuing 2 months refills on medications. And as time progressed, we've adjusted to more online consultations, where the doctors are basically going to be calling, as of this week they've started, calling the patients via telephone or WhatsApp, Zoom, or any other social media capabilities that they may have to do a consultation, and still stressing that they don't come in for their medications, send a family member, that way they're not exposed any at all. In their transporting back and forth from home to here.
How many patients do you serve at the Mercy Clinic?
We have a registered population of roughly 3,200. And out of that, I'm thinking we have about more than 75% active.
Okay, wow. And the age range that you're working with?
We are 60 years and older within the district, the Belize district.
So that's 3,200 just for the Belize district alone?
Right.
Okay. Now, looking at how things are developing with COVID-19 and things like the lockdown, I know that population itself is already at risk for some of the non-communicable diseases. They may have hypertension, diabetes, and several other things that they may be living with. What's been the advice to your patients about staying safe during this time?
We have been sharing information that has been provided by the Ministry of Health. We're trying to all stay on the same page, sharing the same information.
Yeah.
Basically, to stay at home, take medication as per normal, try not to stress, maintain a healthy diet. We know that they can't go out and get that exercise that they normally are used to. But to be creative in the house, in the yard, walk around, and basically stay away. If they have a lot of people coming to their homes, to really limit their interaction, because as we know, we don't know who is a carrier. And we're also trying to educate the family members to be mindful of the fact that older persons are at high risk, so to also limit their interaction with family, the elderly members.
Okay. Now
Yes,
go ahead.
Just to emphasize what Andre is saying, the messages are consistent across the board. What we are promoting right now is the latest advisories that the Ministry of Health issue, just to emphasize that NHI clinics are working hand in hand with the Ministry of Health, and we're in constant communication with the Director of Health Services and the committees charged with coordinating their response. And what the message we're pushing, of course, is the stay-at-home message. And at NHI, we have managed to establish that by doing a teleconferencing protocol that all providers are following. In addition, at the NHI clinics, we have taken measures to create barriers so that we limit the exposure for both the patient and the health professionals, because we know that we have a limited amount of PPEs available. We want to be able to be conservative in the use, but all at the same time make the environment as safe as possible. So for some patients, this has been like a very strange experience. It's almost like a drive-through process. And this has been very important in limiting the contact time that we have with our patients. What we are asking, one message across the board is stay at home. If you have any concerns, call the clinics. And this is what is occurring now at the NHI. We're happy to report that across the NHI clinics, there's been very limited access, people actually coming in.
Okay.
More and more people are calling, which is perfect.
Which is what you want to happen, right? Can you explain why? Ruth, you were saying that you want to see a reduction in traffic at the clinics. Can you explain to us why?
There is, the more exposure, the more opportunities you have to go out there, the likelihood of you getting exposed increases. So what we have done, as we have said before, is to avoid having to go out, and all our health providers have a protocol to follow where they will ask you very key questions when you call in and guide you through the proper care. That is not to say that if you do need urgent attention and you do need to be seen, then you will be instructed to do so and where to go for that attention. So for example, all our respiratory cases, anybody who has any type of flu-like symptoms should be calling the clinic first. The clinics, remember, all our NHI clinics, as I mentioned, are coordinating directly with MOH, and they can be your advocate, they'll be your voice. So when you call the clinic and we go through the questionnaire that helps to identify a possible suspect COVID case, then that clinic will arrange and coordinate your care for you and give you some guidance. So for example, if the symptoms are mild, the doctor will advise you to stay at home still and take some minor medications to address those symptoms. If the condition worsens, then you can again call the clinic, and the clinic will be in direct contact with the focal points in each of the districts. Okay. And they will then arrange where you need to go so that you are not being sent back and forth on, all over the place.
Yes.
And do you find that the patients or the population that you serve have been receptive and adjusting well to the new measures that you've put in place?
Well, for the most part, I would say yes. People are very compliant, and we're grateful for that. But we do have some patients that have been a bit impatient with our providers. Some have been insulting our providers because we have put up some of these barriers. And I mean, it's understandable. It's so impersonal. We understand that. But it's for the best. It's the best approach to ease the burden on the health workers, protect your health force. As this epidemic becomes more localized, it's even more critical that we do these stringent measures to avoid unnecessary exposure for you, the patient, as well. Yeah. And so that has been the challenge. Andre could add to that. For the most part, we have seen that people, though, are compliant.
All right. So what we have put in place here at the center now, I think you have some clips of that, is there's a plastic barrier that has been erected in the main entrance of the building that separates patient and nurse, where the screening is done, a temperature test, to see or question the person's exposure or possible exposure. And then the way they're routed. If it's just from medication pickup, there is no need for them to really see a physician. We have had our pharmacists working overtime in order to pre-pack medications and have them ready for when these patients or family members come in to pick them up. Now, every person that enters the property to pick up a medication is screened. There is no exception. If there is a case of a suspect or anything like that, protocol dictates the flow, which means that we have to notify the focal point in our area, isolate the person, and then what happens from there if that person is required testing or not. So all of that is already laid out in our protocols that we have to follow.
When you say screened, you mean they check their temperature? What type of check?
We do a temperature test, and we ask them. We have questions that was provided, which is a case definition.
Okay.
Have you been around anybody that is a frontline person? Have you traveled across borders any other country? Have you had family members or friends visiting from any other country within a certain time period? Yeah. That is the basic screening that all clinics are doing at this time.
If they're experiencing any symptoms as well. So there are different key questions that are asked. So that's the message. We recognize also that there are among us the population who are COVID positive but have no symptoms.
Yes.
And this is why we're also advising everyone, this is the entire population, that if they must go out, then everyone should don a mask. And we're not talking about the N95 mask because these are limited. They're not available to the public, and they're being managed for the frontliners, the healthcare professionals. But any mask will do. And then we also shared with you some clips on how to strengthen those masks to make them more useful for limiting the types of droplets that are going out there. That's the whole purpose of donning the mask, is to reduce the droplets in the air of the virus and offer some protection. So that is why now we're advising that you use the mask. If you have goggles or glasses, also put them on. And the idea is that it reminds you not to touch your eyes or not to rub your face. It is important that people understand the proper donning or putting on of the masks.
Yeah.
And that video that we share also informs you on this.
Yeah.
We use simple coffee filters to create an additional barrier, and they seem to be very effective. Once again, they are not replacing the N95. I just want to be very clear.
That's not for healthcare workers. That's for everyday people who want to protect themselves.
Right.
Yeah.
All of us will have to go to the store, especially.
Yeah.
If you're going to the store, or you're going to the bank, anywhere where there is public, any group of people, then we encourage that you wear the mask at all times. Even if you're going just to get gasoline, whatever it is you're doing, wear the mask at all times. Yeah. And then you could do it from using the mask you currently have, applying those filters, or using the cloth that you have seen people do as well. The homemade or the sewn mask also work. Either one, it doesn't matter. You can use the filters to create an additional barrier. If you don't have coffee filters, then just put a tissue, or just put additional cloth. Anything that creates more of a barrier to limit the droplets going through.
So there are two things that I'm hearing from you. One, so there are the NHI clinics in Belize City, and it would be Dangriga too, right?
And the north as well, Corozal.
And the north, okay. So those clinics have now introduced a new protocol. You said that it's like a drive-through process. I haven't been there. Can you explain to me what that means, and what changes people can expect if in fact they do have to go to the clinic?
Okay, so what we're saying is that we created, in most of the clinics, you will see a physical barrier. It's a booth, we call it.
It's a plastic booth.
Right. We have seen it promoted recently on the social media, But we were at NHI ahead of the game. We had already anticipated and created these barriers. So some of them have an actual booth, some of them have enclosed, and as in the case of Mercy, they just enclose the entrance using the plastic barriers, and the personnel then stand behind that booth or barrier. So it adds a level of protection. And so the idea is that if you do walk in, which we're not encouraging, as we said before, call first. But if you do walk in, then you are routed to the first thing you will encounter is the triage, which is behind that barrier, that booth. And then you'll be asked the key questions: what's the purpose of your visit, etc. And if you are respiratory, then you're routed under a tent where you are processed quickly. If you have mild symptoms, you're actually given a prescription and sent back home. You're given, they take your information, which we then keep track of you by calling back. That's one promise we have with NHI. And all the other providers, once we have your information, then the clinic will call you back and check on you and see how you're doing. Also, if your symptoms progress, then you call back. So the only admission or the only time you're allowed inside the clinic is if it's something urgent that requires some attention that then has to be done within the clinic, like dressing or something, suture or something that's considered urgent.
Yes. Now, and in the case of Mercy Clinic, Andrew, we're seeing this video where, people, the new way how people would access services at the clinic, even if they're just picking up medication, which is what you're encouraging people to do. But the telemedicine or talking to your doctor through the phone or through a video call, I'm sure it's new for a lot of your clients, I know some are up with technology, don't get me wrong, I don't want to insult anyone, but some may be more adjusted to wanting to have that human interaction. How did you help them through that transition?
It is, as you said, it is new, but it is something that has been practiced in the US and certain other countries in Europe already. It's been challenging. We have been able to secure cell phones through donations for all of our physicians. So if we must point out, first of all, that patients that are registered on the Mercy, if you see a strange cell phone number calling, please answer. We've had cases whereby they're not answering their phones and then calling back or texting a number. Who is this? So it is your physician that is calling. And we try to walk some of them through the process as to how to access WhatsApp video or Facebook video, whatever means they may have that they can actually see the physician. We can't be face to face physically, but through technology now. And with family members, a lot of us, the younger ones, are, well versed on how to use these different devices and technologies available. And they're also helping patients or their family members to access these services.
And because you're working with a very, vulnerable population, do you find that the patients themselves are very aware of the risks that are apparent with COVID-19? And I'm seeing, behind you, I'm seeing those posters with information. So I'm wondering, how you've tried to educate your patients about all the risks that are out there.
Good question, Gavin. We have found that older persons some of them are not really taking the situation seriously. For example, earlier this week, we had a patient that came in. We knew we gave him 2 months worth of medication. He did the screening, and then we were like, well, is something wrong with you? How can we help you? And he was simply, I just need to come and get an appointment for June. There was no other reason for him to come out. So we basically had to be very assertive to him and explain to him the dire situation that we're in. And if you become infected, there is a possibility that you may die. And he was like, it was a mind jerker to him. I understand now. I didn't realize. Not only that, we realize that the curfew is something new, and these older persons have nothing to do and all they do it. And when you're already at a certain age and used to doing what you normally do, sudden change is a problem.
Yeah.
So
Yes, I would like to add to that. They have those who are, like Andre explained, are not aware, but they also have the other extreme of some people who are elderly, who are actually obsessed or overwhelmed by the media, the information. They are very stressed, and they can't seem to get off the TV. They constantly watching the news, the WhatsApp messages. They get very anxious. They actually become and they have insomnia. Some cannot sleep. It is not adult population. Even I have that anxiety sometimes, wondering if I'm doing enough to protect my family members. You feel that guilt if you don't do the procedure quite right. Then you get the phone calls, and it's things like this that makes us all aware. So my advice to people out there is, yes, be informed, but become overwhelmed by the news. You don't need to see 10,000 videos on COVID-19. You just need to be aware of those that are coming from the Ministry of Health. Do the right precautions, and then for me, I watch musicals. That's what calms me and brings me some joy, because me, I'm a dancer and a singer and all of these good stuff. So that's what keeps me sane right now. And the advice is stay healthy. If you pray, if you like praying and you have a prayer group and that gives you some comfort, then do so. That's fine. And whatever it takes to get your mind off this and have fun. I mean, play games, whatever it takes. And that's the other thing I wanted to say for elderly populations who are not savvy with technology. Ask a family member to help. Also give the clinic the contact number of a daughter or a son or a nephew or somebody else who's very savvy, who can assist and check on them constantly.
It's a great time for intergenerational learning. But let me ask one more question, because Ruth, you said it. We all have that feeling of being fearful that we're not protecting our family enough. For family members of your elderly population or your high-risk population, what's your message to them in terms of the precautions that they should be taking? Because the elderly mom or dad can be safe at home, but if I'm an essential worker moving around, I'm the one who's introducing the risk factors.
That's so true, and I'm living that as I speak. So the message is trying to do the best that you can to maintain the social distancing, even at home. Seriously, open all the windows, let the air through. Then when it's time for shopping, only one family member should go out, not everyone. So I have both my mom and my kids here, and I'm the one that is doing the errands, doing one person. The message is send one family member, and then have an area prepared in the event someone does become ill. Then you are prepared to self-isolate if it comes to that. And then obviously have supplies and whatever you need as much as you can, and be prepared. There's some basic medications that all of us should have, and as we go about, try to purchase some of these, like your Tylenol, your Ambroxol, and some type of antihistamine. That's the basic medications you need to have at home should you become ill with light flu symptoms. That is already ahead of the game.
Okay.
When I bring groceries or do shopping, wash this out with soap and water before you put them away. Some people also take your shoes off if you want to, if that gives you additional comfort. Whatever it takes to give that sense of security to your family member, try and do so. But again, don't go overboard also with this. In the house, we clean and mop every day, dust every day, wipe the counters, the bathrooms. And just plain Clorox, guys. Don't go buying expensive products. Just Clorox, and you dilute it and use that to clean your surfaces. Constantly wash your hands with soap and water.
All right. So the message this morning is that the services at the Mercy Clinic and the other NHI clinics continue. But you are asking everyone, call first before you leave your house to go to any one of these clinics.
Exactly.
Where can we get those numbers?
We sent you that information, and if you could kindly post it, that would be grateful. Very good. We have all the clinic contacts in that PowerPoint we sent, and you will see their contact numbers. Some of them have even provided cell numbers.
Okay.
It doesn't matter. Their staff there prepared to answer those calls, and we are receiving these as we speak.
All right. Well, thank you very much.
So we just have one more point, Marvin,
yes.
please. We know that a lot of our elderly patients don't have access to transportation to pick up their medication, because the local transportations are not, bus services are not running. So any patient out there that needs assistance in getting their medications dropped off, please call the clinic, Mercy Clinic, and we will deliver your medications to you. I have been doing medication drop-offs in the Ladyville area for this entire week, and we will continue to do our part in making sure that the elderly are cared for. We still have the only support service that we were able to keep on maintaining is the delivery of the food for 50 shut-in patients, and that will continue throughout the this time.
That's so good to hear, Andre, the extra mile that you guys are going there and delivering the medication. Once again, for anybody who didn't know, that they can get 2 months worth of medication for whatever chronic illness is or what they rely on, so that they don't have to come back frequently, right?
That's correct.
And they can send someone, because they're high risk, they can send someone to collect that medication for them.
That's right.
And if there's no transportation, then Andre is the personal delivery guy. For the elderly population at Mercy Clinic only, let me be clear.
Yes.
Guys,
we wish we could do it for everyone, but our resources are limited, but we are issuing the 2 months prescription, and that includes for family planning as well.
Okay.
And any other service that requires that refill.
Excellent.
Okay.
Guys, thank you for joining us and letting us know how you are continuing to do your work, protecting your population and also protecting your healthcare workers. We appreciate it, and best of luck. Stay safe.
So much. Thank you.
As well.
All right.
Take care.
Great. We're going to go ahead now and take that break. And Gavin, I think you are really going to enjoy this one, because you're the chef in the house, right?
I know, so I'm hoping that I can learn some
I don't know, it might be you and our favorite chef, Chef Sean Quillen, teaching me how to do something. But when we come back, we know there's a whole lot of cooking happening in homes across the country. And so we'll have Chef Sean Quillen joining us, giving us some tips for those novice chefs in the house. So please stay tuned.